Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, a different kind of conversation. I speak with Andy Slavitt, the former administrator of the Center for Medicare and Medicaid Services and the host of the In the Bubble podcast. Andy transitioned from the private to the public sector, playing a critical role in the fixing of healthcare.gov and later in the launch of President Biden's COVID effort. Our conversation wanders from how Andy approaches government challenges to what it will take for public health to be better funded, to why it's important for public officials to acknowledge mistakes. Let's listen. Andy Slavitt, thank you so much for coming to Public Health on Call. We know you have a remarkably successful podcast of your own, so we appreciate your venturing over here to talk with me today about government, public health, what works and what doesn't.
Really cool to be here. Great to talk to you again, Josh.
So I want to go back to when you and I first met. It was not my favorite time of my career. We were dealing with a failed health exchange in Maryland, trying to sell health insurance, but it wasn't working. You had been previously helping to save the federal exchange. You came into Maryland and your team played an invaluable role, and now the Maryland Exchange is going great, even all these years later. But I immediately came to think of you as someone who had tremendous private sector experience, but a real understanding of what the public sector needs to do and what brought you more into public service.
I got addicted to this sense of what it feels like to provide service to the public in healthcare, which is, I think, something that I know a lot of your listeners and certainly you and your colleagues known longer than me and way better than me. I kind of came on it late. I'd said sort of a normal business career. I built and was running this organization called Optum. But, something was missing. And when I had the opportunity to go first serve to help lead the turnaround for the ACA, and then when President Obama asked me to stay and continue to run at CMS, it was the time of my life. I mean, I know you and a number of your listeners can relate to this, but when you've got tens of millions of people, even when you get the tens of thousands of people who are counting on you, and many of them on fixed and low incomes, and many of them just sort of get what they get and don't have a set of people that I really feel like they're listening to them, and you get a chance to do something, whether it's for Indian healthcare or for people experiencing homelessness or senior elderly people who are just not getting preventative care, whatever it is, it's incredibly powerful. And for me, it became addicting, and I really loved doing that work. It's just a joy, a privilege.
And so what's different when you get up to go to work at a private company that you're trying to build, and when you get up and go to work and you're running Medicare and Medicaid?
It's funny you ask it that way, because when I started to make it a habit when I was running CMS, of every morning I published my email address publicly, and I would get emails from Medicare and Medicaid beneficiaries. And Josh, they were everything from, I'm stuck in my kitchen in a wheelchair with a battery that's run out, to my daughter is in a group home and I think she's getting abused. And every day I would read, I would respond, and I would have somebody at CMS follow up until each issue was resolved. And just the thing that blew me away was the first time I sent a response to somebody was like, I got your email, I'm reading it now. They're like, is this the actual CMS administrator? You're actually reading my email? And I was like, oh, this is amazing. And then I would get up and I would walk across the mall, the lawn, over to HHS building from my apartment. And you walk into your office, and you can relate to this, Josh. There's one thing that's different. And for me, there was an American flag pole in the office behind my desk. I mean, this is like a melamine 1970s desk. You've seen that building. It's ugly, it's crappy, it's cold, it's dark, it's dim, it's like everything wrong. It's fluorescent, it's neon. But like behind that desk was an American flag. And every day I used to just think about what that meant and how different it was. And in some part because I was there for a limited time. I knew I was only going to be there for 2 years until the end of the term. Every day felt kind of special.
Not everyone who works in public health has that sense of accomplishment and pride these days. These have been some tough times.
And I know people are out there feeling like we're losing more than we're winning. And I would just say it feels that way many days. It doesn't mean we're actually losing. It doesn't mean we're going to lose. I take the climate bill, but it felt like we were losing the battle to actually change climate policy, which, as everybody listening to this knows, is a huge issue in global health. It's a huge issue. And there are a number of people, I'm not one of them, but there are a number of people who just would not give up the fight and stayed at it and stayed on it. And in dark times, including when it looked like we were going to lose this. And we've passed some transformative legislation. Drug costs, something you and I have both spent a lot of our careers thinking about. There were years, decades, when we would have said it was impossible to ever lower the cost of insulin for people. And so these victories emerge with the hard work of everybody who is in public health and who's listening to this stuff. And no, you don't get thanked every day. And no, the public doesn't understand every day. But when the big wins come, and I think we need to focus on delivering those wins for the public, it makes a difference.
So let's talk about how you've delivered some wins. You came in when healthcare.gov was having all kinds of problems. You helped us out in Maryland. I'm sure you ran across people who were demoralized, just like you're talking about, people who thought things couldn't get better. I recall just feeling like you were throwing me a lifeline at the time that we met. What is it that you say when you come in that situation? And what was the key to the success there?
Well, look, first of all, it's a whole lot easier when you come in and things are bad because you're going to make them better. So I have come into situations that have been challenged and where people have been at their wits' end and very spent. I would count January of 2021 when I came into the Biden administration and we couldn't produce a vaccine and get it out to people to save our lives, and people were very angry. But you know that with patience and with planning and with effort and with execution and with focus, very few problems are unfixable. And you don't have to even ask people to believe. I remember even that situation in Maryland until things start to get better. And you just have to say, I'm not going to quit. I'm going to be with you until this thing gets fixed, and it's fixable, and we can fix it, and we'll overcome obstacles. And that is a very stressful process. I'm not going to lie. I mean, each of those things in retrospect, because they worked out okay, sort of feels like they have this narrative arc where it was like, yeah, it was bad, but we knew it was going to get better. That's not true.
Right.
Like, part of the reason why it is so stressful is because you aren't actually sure you're going to fix things. But it is interesting once things start to get turned around and you start to see people are actually getting insurance who've been dying to get it. And once you get a little bit of momentum.
So talk to me about coming into the White House in January 2021 and what that effort took.
So when they first called me, Ron Klain and Jeff Zients, I had already had a couple of conversations where I had been making it clear that I couldn't come in and serve in the administration for a variety of reasons. And The third time they called me was after Christmas 2020. If you recall, Donald Trump had not conceded the election. I'm not sure if he still conceded the election. There had been no transition work done. I was in communication with the Trump administration around their COVID response to some degree. And the picture we were starting to get was not a good one. It was one where they didn't have, they had promised the country that there'd be 100 million people vaccinated by the end of January. They'd had maybe a couple of million. There were no vaccines in inventory. There was no real distribution plan. And what I found after I came in, it took me about 2 days to discover that of the vaccines that were getting out to states, only about half of them were actually getting into people's arms. The other half were just disappearing into the ether, and there was no system. And meanwhile, 2,500 people a day were dying from COVID. People were getting online every day, pounding computer, looking for places to get vaccines. People were very frustrated. Faith and confidence in government was at an all-time low. I mean, we could be critical about the current situation and plenty of things to be critical about with President Biden and so forth. But he took a situation that was 2,500 people a day dying. We couldn't get vaccines out into the country. We had no plan. And with the president's leadership, we made a difference. And the president said to me, because I was tasked with going out and doing public briefings and public communication around getting people vaccinated, he said, "Look, Andy, I don't care how you make me look. I don't care how what you do reflects on the presidency. All I want you to do is give people the information they need so they can get vaccinated and get better and take care of themselves and their family. That's it. That's your charge. Simple as that." And I went out and said, and in fact, look, we have a shortage. I don't think anybody had uttered those words. Now, that shortage will only last a period of months, but during that time, it's going to be uncomfortable. We in this country are not used to not having what we want when we want it. And so it's going to be tough. But by X date, we are no longer going to have a shortage. And in fact, at some point, we're going to have more vaccines than we have people who want them. And I know it's hard to picture that day, but Josh, literally half of our work was getting enough vaccines out the door. And then half of our work was solving what we all thought would soon become a demand issue in communities of color, in conservative communities, in communities of young college students, where we thought demand was going to hit a wall. And so our work was really on those two topics: get enough supply, help on the demand side, and hope to do it fast enough that we could beat the coming variants. And, we did with Alpha, but we didn't with Delta, and, which we certainly didn't see coming. But we raced the clock against Alpha, and we got enough people vaccinated fast enough. And that was an incredible couple of months.
I think people who are listening are appreciating the kind of fix-it spirit that you bring to your efforts. You come in, you size up the situation, you figure out what needs to be done. You're positive even when people are demoralized. There's been a lot of negative news about what public health can do over the last couple of years. And I don't just mean like political disputes over masks. I mean the gaps in data, the challenges in different parts of the country getting testing and vaccines out. We're seeing some of those same complaints surface over the monkeypox response. What do you say to people who are, questioning whether or not government can really rise to these big challenges?
It's interesting. I gave the address at the Minnesota School of Public Health in 2019, right before the pandemic. And I was asked to reflect kind of on the role of the public health professional pre-pandemic. And even back then, I would say the public health people are sort of the stepchildren of the healthcare system. We all know that famous surgeon that could come in and save the day, the ER doc that fixed up what was happening with one of our relatives, we don't quite see the person that makes our water safer to drink. We don't quite see the people that work and have basically extended the lives of people in this country by a decade over the last 100 years. Most of the gains we've made have come from big transformational changes to our environment, our safety, our quality of living. That's all public health. And public health doesn't get the credit for that, nor does public health get the credit for the disasters we've avoided. The Zika that didn't ravage us, the SARS-CoV-1 that didn't ravage us, the Ebola that didn't ravage us. So we are in thankless, you are in thankless professions. You are doing the fundamental work that makes our country better. And I will tell you, it gets recognized in years and decades, not days and weeks. But it does get recognized. And part of the hazard of it not getting recognized as frequently as it needs to be is the country doesn't put the priority and the resources against public health that it does against other things that are much more visible. We know when our soldiers have old weapons, and so we pass bills to get more modern weapons and jeeps to our soldiers. But when people are out on the front lines fighting public health crises without data, it's much less visible. There's much less compassion for it.
How might it be possible to get more funding for public health in today's political environment?
We have to have a reformer's mindset if we do want those resources. And this is my push to public health. It's to say, we're under-resourced, give us more resource. That doesn't work, as well as saying, we have to reform ourselves and become more effective and earn the public's trust for those resources. And the CDC can't not acknowledge that it has reform and improvement opportunities. I don't think people need to, throw salt in our eyes and say, oh, woe is me, CDC, we messed up, find fault, etc. I think we do need to say is we are getting better at all the time. We are learning all the time. We are transforming all the time. We hold ourselves accountable, and we are investable as a set of human beings that are looking out for the lives of people in this country. We are the most investable return you could ever make. $1 you invest in us will be so well spent. And here's the story, and here's how, and here's why.
Honesty as a path to recovering some trust and feeling some confidence about what can be done to improve the situation.
And accountability, because I think we have to look ourselves in the eye and say, every time we say, well, we gave you the best information we had at the time, whether it's about masks, about schools, and when that changes and we say, well, gee, how do we know we were just doing our best? We're asking people to judge us based on our intentions, not based on our actions and the results. And what would it hurt? What would it hurt to say, you know what? We got it wrong. We got it wrong, and if we knew better, we would have said X and Y and Z. I think that the public responds better to feel like, because otherwise you're in a situation where you were never wrong. You always just did the best you could at the time. You never were wrong. You never admit a mistake. You never did anything that looks like arrogance. And it looks like we're talking down to people. It looks like we're talking over people. It looks like we're not listening to people. And what would be the harm in saying, if we had it to do over again, our advice on schools would have been different. Here's what it would have been. I think it's very hard for people in the political sphere and people who are feeling vulnerable, like public health professionals, to feel even more vulnerable by admitting mistakes. But I agree with you, Josh, that part of the honest path to regaining trust is not just to say, hey, we don't know, or hey, we did the best we could at the time, but it's to continually have a reformer's mindset.
Yeah, well, I mean, maybe to end this conversation where we started, that's what we did in Maryland. We acknowledged that we had made mistakes and that we need to do things differently. In fact, that actually gave us
How did the public react to that?
I think that the public gave us the opportunity to fix it. They gave us the opportunity to essentially unplug the first computer system that we had tried and put in a different one, and gave us the space to succeed. And Maryland, well after I've left, has just thrived, that exchange. Many people have gotten health insurance that they needed through it. It's also been used for a whole bunch of other great purposes. And I do think that people can respond well. Now, we're in a tough environment sometimes. Social media wasn't quite, what it is now back then. But I think, in a way, you helped give us the confidence to do that. You had a vision of things being fixed. You allowed us to both be honest and be hopeful at the same time. And I think it's that combination that is a path for public health at this difficult moment.
You got to make commitments and be willing to be vulnerable enough, as you did in that situation. It's not easy.
Yeah. Well, Andy Slavitt, thank you so much for talking to me about this, giving, I think, our listeners a chance to appreciate all the great work you've done in your career, and also how that work isn't just in the mechanics of what you bring to government, but in the spirit of what you bring to government. So thank you.
Appreciate that, Josh.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.